Rowan, thank you very much for joining me today. Can you please start by just introducing yourself and Parkinson's UK for me, please?
Yes, hi, I'm Rowan Wathes. I'm an Associate Director at Parkinson's UK, and I'm responsible for the Parkinson's Excellence Network, which is our vehicle for transforming health and care services for people with Parkinson's.
Perfect. And so what is Parkinson's? For anyone who might not know, what causes it and what's it like to have it?
So Parkinson's, everyone's heard of Parkinson's, but it's actually a commonly misunderstood condition. It's a progressive neurological condition, which means it progresses over time. There is currently no cure, sadly, and it affects the nerves. So essentially it's an issue with dopamine, the neurotransmitter dopamine, and the cells that produce dopamine are not working properly, they die, and people can't benefit from that neurotransmitter, and that has all sorts of effects on people. Parkinson's is associated with more than 40 symptoms, and everyone has a slightly different presentation, which symptoms they experience and how severe they are. The classic symptoms are tremor, rigidity or sort of muscle stiffness, and slowness of movement, but it's actually the non-motor symptoms that often bother people as much as those motor symptoms, and that can range from pain, apathy, fatigue, hallucinations, psychosis, all sorts of different symptoms that may occur. And as I said, it's often those non-motor symptoms that can be more troublesome to the individual than the motor symptoms.
And how common is it, and who is most at risk?
So there are 145,000 people currently living in the UK with Parkinson's. It gets more common with age, so with our current ageing population we expect that number to increase to around 172,000 by 2030. So Parkinson's is the fastest growing neurological condition in the world, and another way of looking at it is looking at the lifetime risk. So each of us has a risk. 1 in 37 of us will get Parkinson's at some point in our lives. People think it just affects men, but it does affect women just, almost as much. Men, it's slightly more common in men, but it affects just, a large percentage of women. And it does affect people under the age of 50. That's known as young onset Parkinson's. It's not just a condition that affects older people, although it is more common in older people.
And what sort of support is there out there for people who are living with Parkinson's?
So the mainstay of support is through the NHS, through sort of specialist Parkinson's services, either usually led by neurology or care of the elderly. But there's lots of other elements of support that people can access. Parkinson's UK is the biggest charity in the UK for people with Parkinson's, and we support in different ways. Firstly, by investing in research, and we're looking to find a cure, obviously, but also we're doing a lot of investment into research around improving management of symptoms. We also have a big information and advice branch, basically part of our charity, and that's through the website, through the helpline, through lots of different channels, and then the work that I lead, which is through influencing health and care services. So Parkinson's UK is here for people with the condition, and we're here to support them in many different ways. The website I mentioned, that's parkinsons.org.uk, so do take a look, and if you have any people under your care, then you can refer them there for help and support. We have lots of resources on our website through the Learning Hub, which are aimed at sort of non-specialist professionals, so across the board, ranging from short bite-sized learning sessions, up to 15 minutes, to some more detailed sessions. So whether someone has kind of a bit more time, or whether they really just want to browse something on the train, we've got lots of different options available to people just to kind of give the basics of Parkinson's and really help people better understand it. And there's a podcast as well. So lots of different things on the website aimed at professionals so that they are well equipped to manage someone with Parkinson's.
So bringing it to the dental profession now, how can kind of professionals help to support their colleagues who might be living with it and also their patients who might be coming in for treatment?
Yeah, okay, so in terms of colleagues, as I said, the condition is very different depending on who you are. It affects everyone differently. So the best thing is just to talk to that person and ask, which elements would help them. It's not kind of one thing would help. It'd be different for each individual. The second thing I think is just doing a bit of reading to understand the condition a bit more. As I said, it's commonly misunderstood and people just think it's a condition that affects movement, whereas it's much more than that. So I think just perhaps having a browse on the parkinsons.org.uk website, understanding a bit more about the condition, that would help someone who's looking to help a colleague, and often it's just a few adjustments that can make a big difference to someone that they're working with. In terms of looking after, in terms of patients with Parkinson's, I think again it's about understanding the condition, understanding how it can affect people. I think some simple things like helping people get in and out of the dental chair, giving them a bit more time, being that little bit more patient with them just as they're taking their time to move. It affects facial expression and facial movement, so it might be a little bit more difficult to open the mouth as instructed, and so just again having an understanding of that. And the other thing that is can happen in Parkinson's not infrequently is drooling, which is a side effect of is a result of the condition. And so just being cognizant of that when you're doing sort of lengthy dental examinations or procedures.
Perfect. Well, thank you very much for joining me today. It's been great to hear more about how dental professions can, learn more about Parkinson's so that they can support their patients and colleagues. So thank you very much. It's very helpful.
Lovely. Thank you.